Nigeria Center for Disease Control has declared an outbreak of Lassa fever and activated an emergency response center to coordinate responses. Now, this follows an increase in the number of Lassa fever cases reported across the country since the beginning of this year. About 60 reported cases have been confirmed in ONDO, EBONYI, Edo, BAUCHI, the Federal Capital Territory, NASARAWA, and TARABA and PLATEAU states. 50 years since the first case of Lassa fever was discovered in Nigeria, why are we still having deadly outbreaks? How much has Nigeria risen to the challenge, since most of the cases of the disease in the world occur in Nigeria? Is it possible to develop a vaccine or drug soon that will completely eradicate Lassa fever in Nigeria? We will be back with answers to these questions and more on Nigeria Today. I am Dennis Adingloye. Welcome. All right, seated with me in the studio to discuss yet another Lassa fever outbreak in Nigeria is Dr. Emmanuel Agogo, the Deputy Director, Prevention and Program Coordination from the National Center for Disease Control, NCDC. You're welcome to Nigeria Today, sir.
Thank you for having me.
All right, well, we're in another state of concern with all these Lassa fever outbreaks that have been recorded in recent days. 50 years since the first case was discovered in Nigeria. How big is the challenge of trying to eradicate this deadly disease called Lassa fever from the country?
So, just like you said, 50 years ago in Lassa in Borno State, the very first case of Lassa was identified. It was a missionary nurse who fell quite ill and had to be repatriated back to the US. And in the process of trying to find out what was the cause of her illness, they found out a new virus. Subsequently, it's been found that this virus was not only in Nigeria but across West Africa. So we've had the established cases in Liberia, Guinea, Sierra Leone, and those of and a few of our other neighbors in the West African sub-region. The virus causes what is termed the viral hemorrhagic fever. So the viral hemorrhagic fever is one where you fall ill, and you don't only fall ill, you also when you get complications, it affects the way your body works and your body's clotting system works. And so at some stage you start bleeding. So you could bleed from your eyes, from any orifice, and small cuts, and the pregnant woman could get an abortion from that. So it's a disease that 80% of people will have a mild disease, but there's about 20% of those who fall very ill have huge fatalities. And unfortunately, the fatalities and the serious cases we're seeing are among people who are presenting quite late to hospitals in these hotspots.
Okay, the disease is caused by a virus, I understand, from the same family as the dreaded Ebola virus disease. This makes it obviously an extremely dangerous virus to be exposed to. So how seriously should we be taking this disease?
So they both cause, they're slightly different viruses and slightly different families, but they cause the same kind of illness, which is a viral hemorrhagic fever. Right. In terms of virulence, that is how aggressive the virus is. The Ebola virus is a bit more, it seems to be, from evidence, quite a bit more aggressive. In terms of how it is transmitted, however, from the experience from our recent outbreak, the recent outbreak that occurred shows that still 90% of the mode of transmission of Lassa is still zoonotic. So that means it comes from animals to humans. It is possible for human-to-human transmission to occur, where an individual is exposed to bodily fluids of someone who is unwell, especially in the acute phase of the illness. And so when that happens, that human-to-human transmission can occur. Ebola, on the other hand, is primarily, although zoonotic in nature, the transmissibility between individuals is much higher. Unfortunately, last year, failure, breakdown of what we call infection prevention and control, which is, that process of preventing yourself from getting in contact with the fluids of another person within the hospital setting. When those kind of mechanisms fail, then you expose yourself to that, to catching infection.
Okay, what would you say is the major challenge that the Nigeria Center for Disease Control is facing with regards to keeping this outbreak to the barest minimum and managing it towards looking towards eradication?
So I think that we've learned quite a lot in the last few years. Previously, Lassa fever has been presenting a lot as outbreaks, but over the years we're beginning to notice a pattern. So there's a seasonal pattern to the outbreak. So usually at the beginning of the year, peak of the dry season, towards March, April, then we start seeing a drop in cases. So knowing that that was the pattern, there's been preparations put in place since the end of the last year, prepositioning things like protective equipment, personal protective equipment, prepositioning medication, a lot of training and upskilling of healthcare workers, and then a lot of training also for communities in those hotspot states, because 80% of the cases that happened last year were in 3 states, so Edo, ONDO and EBONYI states. So those were the hotspot states, as we call them. And having said that, there were a few other states across the country that also experienced cases, and therefore systems were also put in place to expedite the diagnosis of the cases, expedite availability of medication for treatment, and also fast-track access to life-saving treatment as well.
All right. What is peculiar about these particular states that it seems year in, year out that they are the most prevalent in terms of cases of Lassa fever?
So fortunately, just last week there was a huge conference in Abuja, which was the first ever Lassa fever international conference convened by the NCDC and her partners, with support from CEPI, Bernard Koch Institute, the WHO, CDC, and so on. So quite a few partners came together to talk about Lassa fever, and there were a lot of scientific papers and presentations where people have looked into the epidemiology of Lassa fever. There were some interesting ideas that came through. One was definitely that the impact of climate was severe. So of course, increasing temperatures, lack of rainfall, those are drivers. Other things are the gaps that we have in our understanding of the interface between humans and animals. So there were some studies that looked at how if when rats leave your house, if they come in, do they go back in? So there were some studies where they used some trackers on some mice on some rats to see whether they would go back and come into the house, and there was evidence to show, these were done in Sierra Leone, however, to show that this ongoing interface between the humans and animals, in this case this multi-mammate rat, increases the risk of transmission. So when your foodstuff gets in contact with the urine or the feces of a rat that carries the virus, then you are exposed to it. And also in many of those communities, you find that they produce foodstuff, they use, they dry it out in the sunshine, they use, the elements to dry out food and so on. And also in many of those households, food isn't properly covered, you don't have, the mechanisms for keeping food quite safe. There are no processes for deratting where you ensure that you get rid of the rats all the time. And so some of those factors are some of the drivers. So some
of the human practices with regards to food need to be revisited and
sanitation as
amended.
Well. Sanitation, how do we keep our surroundings clean? Those are key factors as well.
We'll get to the practices of people a little later in the discussion. Let's talk about the emergency response centers. What exactly does it mean to activate these centers in terms of eradicating the disease?
So in the aftermath of the Ebola crisis, there's been a change in the way people respond to outbreaks. So there's been a move to a more coordinated and more organized ways of dealing with outbreaks when they occur. Several approaches have been adopted. One is the One Health approach, and that means that when you have an outbreak like this, especially if it's a zoonotic disease, you bring all the stakeholders who are involved, so human health, so the the doctors, the nurses, the people in the health profession. You have the colleagues from the agri sector, so you have, you know, colleagues with veterinarians and people who have that experience. And then from the environmental health sector as well, because it now becomes a more robust approach. And within what they call EOCs is just a nomenclature that describes a method of working where we set up a collegiate multidisciplinary team that addresses core pillars, so key pillars like risk communication. How do you talk to the communities? What kind of messages do you give? Case management. How do you really treat the patient? IPC. How do you, institute those practices that keep you safe? Pillars with epidemiology, which is around collecting the information and distilling it and making sense of where those core issues are happening, and involving contact tracing, where if you have one index case, you go to that community and try and look for anyone with similar symptoms, and also try to identify what are maybe the drivers in those communities. And also laboratory services, where we find we will put in place processes to expedite transfer of samples from where the cases are from the health facility to the laboratories where the testing will be done.
Where would these emergency response centers, where are they located?
So there is a national EOC. We have, like I said, it's not as much. It's the idea. We have a physical space, but it's more a method of working. So we have a physical space. The public health EOC at our office in Abuja, in Jabi. But also one of the things the NCDC has been doing, with support from partners and from state governments as well, has been to set up state EOCs. So a physical space, and provide the training and infrastructure to have, and the technology for people to communicate and for people to interface in about 12 states across the country. We were unfortunate last year as a country to have experienced quite a few outbreaks, including the meningitis outbreak that happened majorly in the northwest. We had outbreaks of monkeypox. We had the outbreaks of Lassa fever. We had an outbreak of hepatitis E a couple of years before. So in those states that were prone to outbreaks, we prioritized those to be states where EOCs will be set up. So the government provided physical infrastructure with partners and experience. We went and did training. So in these hotspot states, once the threshold for number of cases is reached, there's a trigger to say, look guys, can we sit down and look at what's happening? And so that triggering of an EOC, declaring of an emergency, means that people need to sit down and take it seriously. And of course, the national level, there's been huge interest from the very highest levels, political leaderships, from the Minister of State. We were both at the conference last week. And so there's been, once that happens, everyone kind of puts all hands on deck, if you know what I mean.
All right, we're appreciating your views on this quite crucial topic that has an impact on lives and life and limb. But let's take the topic to the streets now. You're watching Nigeria Today, and we are discussing the latest Lassa fever outbreak in Nigeria. Let's join our correspondent Abdul Jibrin to hear what Nigerians have to say about it.
Things I will do not to catch Lassa fever. I have to keep my environment clean. I will not drink dirty water. I will not eat leftover food. Maybe when you expose it, rats can enter inside.
We need a good ventilation to keep our surrounding clean, to keep our home clean.
You have to keep your environment clean. You make sure that you don't leave leftover food, because I think it is caused by a rodent called a rat. So the rat carry the disease. So by the time you leave leftover food and rat passes by it or eats out of it, and the remaining you now consume it. And I had that, like those that sell gari in the market shops, you see rats all around the evening time when somebody have closed shop. So by the time rat perches on the item and you sell it to the customer, now one buys it, takes it home, he consumes it, and he or she will be affected by the disease.
Clean your environment, you clean your house out, you make sure your house, your environment is clean.
Simple thing to do is just to keep your environment clean. your drainage, and to avoid some dirty in the house, in the kitchen, and especially your plates, food, and make sure that you don't keep rotten food around your house, and make sure that your kitchen is neat as well.
All right, the program is Nigeria Today, and we're discussing the latest Lassa fever outbreaks. And we're with our guest, Dr. Emmanuel Agogo, who is the Deputy Director, Prevention and Program Coordination, National Center for Disease Control. You heard some of the comments of members of the public there. It would appear that they seem to have a pretty good understanding of what Lassa fever is and how to prevent it, but we seem to it seems to be a case of they understand the theory, but practically they're not really Nigerians not putting this theory into practice. So what would you say?
Yes, I think the rhetoric, like you said, is quite, on point. They talk about, sanitation, keeping your home clean, and so on. And some of them have given, real good practical examples around, not keeping rotten food around yourselves, having clean environments, And I think I would like to, reiterate that all those pieces of advice are correct. The other thing that I'll also add to that is that we are beginning, because, like I said, having a high index of suspicion is also very important, because if you present early, then the risk of developing complications, if you were affected, is less. Okay. So self-medication is something that people do quite a lot. I have malaria, I'm treating malaria, I've treated it. Once you should get the right help, really. And once you go and you have a test, and the test shows it's not malaria, then the doctor or the healthcare worker that is managing you, the doctor should be able to think about other differentials, other possible causes. And so if you have a high index of suspicion, then it means that you could be, if you have any of those worrying symptoms, you could be diagnosed quite early and you could receive the treatment. So that's one thing I'd like to add. The other idea I'd also like to bring on board is the idea of, infection prevention and control. So during the Ebola period, there was a lot of hand sanitizing, a lot of thinking about how do I handle food stuff, how do I, engage with people. If somebody's unwell, how do I take care of them? So, there was a lot more sensitivity, and I think that is something we need to still think about. And these practices are practices that should become part of how we function.
All right. Would you say then that it's not? This is an issue that's the people of Nigeria have control over. It's not that it's not an outbreak in the truest sense of the word, in that we have authority over it in terms of how we control our management of food items and that kind of thing. So you would say that there's no cause for alarm or panic at this stage?
Yes, I mean, obviously the things like Ebola that happen are pandemics, so huge outbreaks of a very virulent organism that was easily transmissible. So generally speaking, one of the things that also happened in the last year was that in the aftermath of the outbreak, so there was some really advanced the research that was done, that was published in Science earlier this year, and that study looked at the viruses and tried to see the virus, what changed. Was it the vector that has changed? Well, at least it looks better at the virus anyway. But had the virus changed? Had it become more virulent and or easily more transmissible? Which means, is it much stronger, or is it more easily passed from one person to the other? But the studies really show that in more than 99% of the samples that were tested, they still originated from zoonotic sources. So it was still animal to human. Even though some health, we always remember with sadness the healthcare workers that we lost last year. The majority of those cases were, of course, human to human transmission, and so that chain can be broken by instituting infection prevention and control mechanisms. And then the other question that was asked is it the vector that has changed? Are there more vectors? During the conference we had last week, there were people who had done some studies to see are there other organisms that carry, like rodents, apart from the rodents that may carry the virus. So all in all, it is still this core message of sanitation and prevention and case identification and treatment.
All right, we're still on this issue of the research into the Lassa fever. Which stage are we at now with regards to a possible vaccine being developed to permanently wipe out this disease from the shores of Nigeria?
So there are quite a few strains of the lineages, if you like, of the virus. There's some that we have in the neighboring countries. In Nigeria, there are actually 3 of those strains. And some work is being done. During the conference, of course, there was a lot of presentations around looking at pieces of the virus, so some proteins in the virus, and studies were being done to see whether they could develop vaccines that could that could stimulate your body to identify those pieces of protein, which helps you then fight off the infection. So there's a lot of work going on, and one of the key partners in that conference was the CEPI, was the Coalition for Epidemic Preparedness, who are putting some funds along with the WHO and CDC and BNOC and all those other partners into trying to develop a vaccine. There are also organizations within Nigeria. Rurat Specialist Hospital have also been part of this, the Redeemers University, the NCDC. So there are lots of people who are putting hands on deck to look for solutions. However, there is no vaccine in the short term. There's still a lot of work that needs to be done, because with vaccines there's a step process of finding it, using it perhaps sometimes in an outbreak situation to see if it works in exceptional cases, but there's usually a long trajectory to make sure it doesn't cause more harm than good.
All right, let's just go back to symptoms now of Lassa fever, just for the benefit of viewers. The early stage symptoms leading up to death, which is the final possible outcome. Just highlight for the viewer once again what those symptoms are.
So Lassa fever presents very much like most fevers that you would have. So you might have very non-specific symptoms like tiredness, malaise, a high temperature doesn't go away, abdominal pain, joint aches, things like that. So at the very early stages, you might have those symptoms, and then people would have, maybe taken 1 or 2 courses of antimalarials, and it hasn't really worked, because it does have a fairly long incubation period and a fairly long program of about 20 up to 21 days from exposure to actually developing the disease. So in that time you might, and then as the progression from when you start having these mild symptoms, is variable depending on what we call the viral load. That's how fast the virus replicates in your system. On the other trajectory, when people succumb, is when they start developing complications like bleeding from orifices. A woman who might have an extremely heavy period, who should be quite unwell and have excessive bleeding. Sometimes if women are pregnant, they might have a miscarriage from it. You can bleed from your eyes and so on. And unfortunately, what really affects people are the complications. So they could develop kidney problems, blood tests show liver test abnormalities. And like I said, one of the key problems is that your clotting system doesn't work so well. And so that really...
That's the major...
That is one of the major features that you come.
All right, well, basically, like we said, it's a lot of the control of this virus is in the hands of the people themselves. Just give us briefly your final words of advice to Nigerians in terms of their own actions in combating this disease.
Yeah, so I think my final word to Nigerians will be to say that there is no need to panic. The government has worked with partners and done a lot of prepositioning, and treatments are available. The medication for treating Lassa fever is available. Laboratories, we now have up to 4 laboratories across the country, among others, who can do the diagnostics for Lassa fever. If a case is suspected anywhere in the country, there's also transport systems in place that can move them along. But we have a responsibility to, live in clean environments, make sure we're not limiting our engagement with rats and rodents in our homes, keeping them clean environments, and if you suspect that you're unwell, get the right treatment. I think those will be the key things. And then for health workers to have a very high index of suspicion, a low threshold for diagnosing or suspecting Lassa fever, and a low threshold for making a diagnosis too.
All right, Dr. Emmanuel Agogo, Deputy Director, Prevention and Program Coordination from the Nigeria Center for Disease Control. Thank you very much for your insights and advice to the general public on this topic of combating Lassa fever. We appreciate you, sir.
Thank you very much for having me.
And that's all we have time for on Nigeria Today. Thank you very much. once again, Dr. Emmanuel Agogo, for your insights, and also to our viewer. Thank you for watching, and we hope that you were able to take something positive out of our discussions. And remember, you can watch this episode or any other online at www.youtube.com/NTA News 24 Hub. I am Dennis Adingloye. Thanks for your time.
Thank you.